Hi, my name is Amy.
I'm Christina.
I'm Kelly.
And I'm Beth. Our presentation today is on the highly controversial topic of seclusion.
The definition of seclusion itself is often disputed. However, the Mental Health Act 2014 defines seclusion as the sole confinement of a person to a room or any other enclosed space from which it is not within control of the person confined to leave. In our presentation today, we will be discussing why seclusion is used, how it is applied in mental health and illness, and the negative effects of seclusion. We will also be discussing the different perspectives from a nurse and patient, the legal and ethical aspects of seclusion, and looking into ways of reducing seclusion.
When admitted to a psychiatric unit, patients can at times become irritable, distressed, violent, and aggressive, leading to an increased risk of harm to themselves or others. The most common illness suffered by those placed in seclusion includes schizophrenia and bipolar disorder. Nurses endeavour to reduce harm to the patient and others by using various interventions, including the use of de-escalating techniques, special observations, sedating medications, acute care units, and finally seclusion. Seclusion is commonly only instigated when the other interventions have failed. In many studies, it is found that the most common reason nurses give for using the practice of seclusion is for the immediate handling of violent behaviour. Many practitioners believe that seclusion is a necessity for the control of violence, whilst many nurses consider the use of seclusion as a necessary practice in order to facilitate an environment that is safe for both patients and staff.
Behaviours believed to lead to seclusion include attempted self-harm, violence towards another patient or staff member, and inappropriate sexual behaviour, along with occasionally to prevent property damage. It has also been noted that some health professionals feel that by using seclusion and removing the patient from the ward, not only does it preserve the patient's dignity, but also is less disruptive to other patients.
Due to the high amount of controversy in the use of seclusion, the United Nations developed a principle for the protection of people with mental illness and the improvement of mental health care. This particular policy states that the physical restraint or involuntary seclusion of a patient shall not be employed except in accordance with the officially approved procedures of the mental health facility, and only when it is the only means available to prevent immediate or imminent harm to the patient or others. It shall not be prolonged beyond the period which is strictly necessary for the purpose. All instances of physical restraint or involuntary seclusion, the reasons for them and their nature and extent shall be recorded in the patient's medical record. This policy assists in maintaining the dignity and respect for those being exposed to the seclusion intervention.
Okay.
Seclusion and restraint are not benign interventions. Significant morbidity and mortality have been associated with them, such as attempted suicide or self-harm whilst in seclusion. The impact on people subjected to these practices can be detrimental and lead to tragic consequences, such as falls, injuries, or even death. It also risks bringing up traumatic memories in patients with a history of trauma or loss of dignity, along with feelings of abandonment and isolation. Patients subjected to seclusion have also shown dissatisfaction with the intervention, stating that the experience was negative, frightening, cold, and untherapeutic, increasing feelings of distress and agitation.
Seclusion can also lead to decreased functioning and longer lengths of stay. Individuals subjected to seclusion may also experience damaged interpersonal relationships and a breach of the therapeutic relationship with their treating healthcare professional, due to the feeling as though they can no longer trust them. As a result of these detrimental side effects and negative results of seclusion, its implementation is seen by many as a violation of the human rights of people with disabilities and those that have experienced restraints, and seclusion reported as a sense of violation to their personal integrity, along with the sense of abuse, helplessness, and insecurity.
In order to understand how seclusion can affect an individual, 2 nurses volunteered to spend some time in seclusion to try and have a better comprehension on this type of intervention and the general view that the whole experience is inhumane. The nurses that experienced the seclusion found that it increased their anxiety and frustration levels. They felt that during their whole experience they did not find the level of care they received to be caring, and felt as though it was more of a punishment than a treatment. Excluding the nurses subjected to seclusion themselves, the general opinion of nurses in the mental health field is one of support for the use of seclusion. However, they are unsure of how effective this treatment method is and if it actually has any therapeutic value. It is suggested that the majority of nurses consider seclusion to be significant in the promotion of safe well-being for patients, and that without seclusion, staff and other patients may be at risk of harm.
Along with the personal effects experienced by those undergoing seclusion, there are also other implications to consider. Seclusion is known to contribute to workplace violence and can cause a reduced quality and effectiveness of care. Seclusion has a large economic cost involved as extra staff is needed to implement and monitor this practice. These costs include obviously the physical injuries to the staff and patients, along with the medication costs and potential for legal action as a result of seclusion. Litigation costs and legal judgments can be the most costly part of this practice if an injury or death happens to occur during this intervention.
The legal issues related to seclusion remain complex and unclear. There are many variations across Australia in regards to the policies of applying seclusion. However, legislation is in agreement that seclusion may only be used after all reasonable and less restrictive options have been attempted and have not worked or are not appropriate, and bodily restraint may only be used to administer treatment. Seclusion is generally deemed lawful when used for patients receiving mental illness treatment, when necessary to protect a patient or another person from risk, or to prevent the patient from absconding when in need of help.
The authorisation of seclusion can only be done by an authorised psychiatrist or registered medical practitioner or senior nurse on duty if a psychiatrist is not available. If authorised by anyone other than the psychiatrist, they need to be notified as soon as possible so that the patient can be examined to determine the continuity of the procedure. The parent, guardian or carer of the patient, along with the Department of Human Services, must be notified of the situation. Most Australian Mental Health Acts state that the patient must be regularly reviewed by a registered nurse at intervals of 5 to 15 minutes and 4 to 8 hourly by a registered medical practitioner.
Along with the legal aspects of seclusion, there are also the ethical areas to be considered. The differing views on seclusion present clinicians with an ethical dilemma, and ethical conflict arises when one attempts to balance the patient's right to autonomy and the responsibility to prevent harm to self and others. Mental health legislation defines seclusion not as a treatment as such, but rather a management tool, enabling other treatments to take place, such as medications or counselling. This definition enables the use of seclusion to seem slightly more ethical, as it isn't a treatment for a specific condition, but rather a necessity for a certain situation. In order to meet ethical requirements, patients must have appropriate bedding, food and drink, and access to hygiene facilities. Some facilities will also have the patients monitored on a screen at the nurse's station, whilst others will have a nurse stationed outside the room for the duration of the seclusion.
The use of seclusion has been controversial for many decades, and this is thought to be associated with discomfort on both the staff and the patients involved. The World Health Organization has suggested for a while now that isolation rooms should be eliminated and new rooms should not be created, though the Australian legislation has not yet adopted this policy. In saying this, there are changes occurring in seclusion practices, and seclusion reduction policies are in place in both Australia and New Zealand. The Australian government's formed the National Mental Health Seclusion and Restriction Project, with the primary aim of reducing and, where possible, eliminating the use of seclusion and restraint in public mental health services.
There has been the introduction of alternative ways for patients to help to calm themselves when they are distressed or become violent. These de-escalation techniques are an important intervention as they help to control the escalation phase. Some of these include quiet rooms as well as sensory modulation, which helps to decrease a patient's distress during times of heightened arousal, all of which reduce the need for seclusion. Nurses interact with patients when they appear to be distressed, engaging with them and offering strategies like listening to music, aromatherapy, and also massage chairs.
Staff also provide one-to-one time for the patient to vent about the issues and the negative things they are feeling. By using both verbal and non-verbal communication skills, the nurse can express genuine concern for the patient and appear non-threatening. They must ensure they remain open and use the de-escalation tools of honesty, support, non-judgment, and ensure they appear confident but not arrogant. The nurse must also be calm in affect, even if they are anxious on the inside, as maintaining a calm presence will help to control the situation. They must ensure they use a calm and soft voice when communicating with an escalating patient. These techniques will hopefully cause the patient to not take their frustration or other negative feelings out on themselves or others, therefore reducing the chance of violence or distress.
In order to effectively manage these situations, it is valuable for the nurse to establish the patient's preferred strategies and comforting measures early on admission, so that the patient can have some control over what happens if they become actively distressed. As early intervention is the key to de-escalating aggressive behaviour, I should probably start again because I touched my hair. I was like... In order to effectively manage these situations, it is valuable for the nurse to establish the patient's preferred strategies and comforting measures early on admission, so that the patient can have some control over what happens if they become actively distressed. As early intervention is the key to de-escalating aggressive behaviour, the nurse and treating professionals should also be conscious and aware of any previous experiences of seclusion that the patient may have been involved in. This allows the health professionals to watch for signs and symptoms that the patient may be becoming aggressive or agitated, such as increased movement or hyperactivity.
The use of seclusion as an intervention for mental health is a highly controversial and well-debated one. When used to de-escalate an aggressive...
Restart!
Just start again, that's fine.
Starting again! The use of seclusion as an intervention for mental health is a highly controversial and well-debated one. When used to de-escalate an aggressive patient, it is beneficial in ensuring the safety of the individual, staff, and other patients. However, there are many legal and ethical aspects that must be considered due to the negative implications of the seclusion intervention.
Our aim as healthcare professionals should be to continue to treat all patients in a humane and fair manner, whilst respecting their rights and freedoms.
In an ideal world, no person should lose their right for freedom, but regrettably, acute mental illness can make that impossible.
When all other interventions have failed or are unsuitable, seclusion should be used for emergency situations only.
If and when seclusion is used, it is imperative that current safeguards be in place and policies be in accordance with professionals and national standards. Thank you for watching.